Hey guys, welcome to week 27. Actually, it's week 27 in a couple days, and I'll explain why. First off, I want to say I'm sorry for not posting the video on Wednesday. It is now Sunday, but I'll explain why. On Wednesday night, I was having really bad chest pains, and I felt like my lungs were about to collapse, and really horrible headache. So I tried to sleep it off Wednesday night, and I could not sleep at all, and the pain was getting worse and worse and worse. So on Thursday morning, I ended up going to the emergency room, and they admitted me in there for the day. And they're checking me out because I don't know if I mentioned it, but I've been having breathing problems, and my doctor was sort of concerned. They gave me EKG, and it came back normal. But I'm scheduled for an echocardiogram on next Wednesday, just to make sure that everything is okay. Well, my breathing was really, really bad, so I went to the hospital, and they admitted me in there, and I was there all day long. They're running tests on me to make sure I didn't have any blood clots in my lungs. That was the worst case scenario. So they did an ultrasound on my legs and a CAT scan on my chest, and it came back normal, thank God. It turned out that there was just inflammation in the muscles of my chest or something. And basically, what happens, if you move too much, since like the baby's pressing on your diaphragm, it can cause things to inflame, and it can be really painful, and that was causing the chest pains and my lungs to feel like that they were about to just collapse, and it was so painful. The hospital visit was horrific. I was there all day long, and they gave me IV in this arm, but they couldn't get it, I guess, so they tried it on this one for the CAT scan to put the medicine in for the dye. Um, when I went up there, they said, "Oh no, you have to have it in this arm," and I tried to tell her that they already did. So she switched my IV, but when she didn't take this one out before she put this one in, she forgot to clamp this one back, and I started bleeding everywhere. Like there was blood everywhere. And then she squirted me in the eye with a syringe, which is the IV fluid. She was trying to get it in there, and she squirted me in the eye with it. Then she butt my toe in the door. So, like I said, I was in there all day long. They did my test. My test came back normal. It was just inflammation that was really painful. And I found out that I have a mild heart murmur, which I guess the doctor wrote in her notes, but I didn't know that. So, I mean, what it is, if you don't know what a heart murmur is, it's just when your heart skips a beat, which it's actually, it could be common in pregnancy, and it's supposed to go away. So they're not really worried about that. But I still have my echocardiogram on Wednesday, so I'm still going for that. And I have to have a follow up checkup. My next actual doctor checkup is on March 9th, but they want me in there earlier to make sure everything's okay. So, like I said, it was just inflammation, so I'm fine. I was just in there all day long. I got admitted before noon, and I was there till like 10 o'clock at night. And I was there most of the day by myself until Jeff's mom arrived. Jeff was really freaked out when he found out they put me up and straight up into labor and delivery, which after 20 weeks you have to. But everything's good with her. She was moving more than I've ever felt in her life. Um, Ever since Wednesday, she has been crazy moving. Like, it has been painful. But I'm blessed because she's happy and healthy. Her heartbeat was normal. Everything is good with the baby, thank God. Um, they still have to do some more tests on me, like the echocardiogram, to make sure that there's nothing wrong with my actual heart. But, apart from the murmur, to see how big the murmur is, I guess. But everything's pretty settled right now, so that's good. Everything, like I said, it's been really hard to get around. I've been in bed for the past couple days because things have been so painful. I feel so swollen, and just it hurts to talk, it hurts to do anything, like it hurts to even walk. So I've been trying to take it easy. That's why I haven't made the video. My breathing is still, I still have to catch my breath like every couple of seconds, and it really sucks. Hopefully that'll go away because I don't know, but they said the inflammation's supposed to go away by itself, so hopefully it will. Um, on the bright side, Jeff comes home in March. I haven't seen him since February. I haven't seen him since January, so it's been almost 2 months, and I'm really excited about that. And he should be here around maybe the 7th. So he will actually, if he comes, he might be able to be here for the very first doctor's appointment because he never was able to make it to any of the other ones. So he'll get to hear the baby's heartbeat and stuff. So next week, Wednesday, so it's Sunday now. So Wednesday I will be 28 weeks, which is 7 months, which is the third trimester. So my last trimester, I'm super excited. I can't wait to see how fast that goes. I hear that the last trimester goes by the slowest, but everything's good with her. Everything's good with me. I'm just trying to get better because I just feel really, really bad, really dehydrated. I haven't even been eating very much. I've been eating like breakfast and dinner, that's it. And that's not common for me because in my pregnancy, my appetite has been very, very big, but not so much anymore, like ever since I've been sick. So hopefully I'll go back to normal and I can start getting, a little bit of my energy. For the third trimester, I'm trying to work out as much as possible to make the labor go by faster and, a little easier. Um, Changes when I sleep, my stomach is so big that when I roll on my side, it props my back up and it hurts really, really bad. But I've been getting bigger, so I guess I'll show you guys that now. This is 28 weeks, 27 weeks, my bad. And my belly button is kind of, so, yeah. 27 weeks in a few days. 27 weeks in a few days. So, I guess that's pretty much it. Besides the horrific hospital visit, hopefully that's it. So it's just a quick update, and I'm sorry about the video. I'll be back. I'll probably wait a couple of days to do the week 28 update because I'm sure nothing will change in just a couple of days. So I'll probably do my week 28 update in just a couple of days. So after my week 28. So I might wait until my echocardiogram appointment just to let you guys know how it was, which is on Wednesday, which is my week 28. But I'll probably wait a couple of days. So I guess I'll see you guys back here for my week 28, and I hope you guys have a good rest of the weekend.